Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and I am back in the Sunflower House. It's the summer of 2023. We're just ending one academic year, getting ready for a new one. And joining us on this episode on Rumble, as well as our podcast channel, is Chad Schlesinger. Chad is the Senior Program Manager for the Obstetrics Gynecology Institute education at the Cleveland Clinic. And he has graduate level education in healthcare administration and industrial organizational psychology. And he also was a chef for 15 years and has quite a varied background and lots of educational talents. And he helps us recruit top-notch physicians for multiple women's health fellowship programs throughout our institute, including the fellowship that I've been running for a quarter of a century, the Specialized Women's Health Fellowship Program. So welcome, Chad.
Thank you. It's great to be here.
Well, thanks so much for joining me. Tell me a little bit about your professional background before the Cleveland Clinic. Before you joined us. Was that about 4 years ago you've been with us?
I've been with our institute for 4 years and the clinic in general for about 8. But before that, I was, as you mentioned, a chef. I worked all over the country cooking food for wonderful people. And then I decided to go to school. My first master's degree is in healthcare administration. I also have an undergrad pre-med. And I'm finishing up a second master's degree right now in industrial organizational psychology. In my time here at the clinic, I've been a unit coordinator, as well as several other tasks within graduate medical education. So here's where you find me.
Well, that's great. It's really been a pleasure working with you, and I know that our current and past and our future fellows, I think, are going to definitely enjoy your leadership and your guidance, because you really know this system very well. And so didn't you work with Emeril Lagasse? I always liked how he kicks it up a notch with where is the towel that you're throwing over your shoulder, because we kick it up a lot of notches here at the in Speaking of Women's Health. That's
right. I worked for him in his prep kitchen for about a week or two. But that was a very long time ago. I was but a teen. But it was a very formative experience.
Oh, yes. So talk to us about the role specifically with the fellowship program.
So I'm technically a program manager too. I sort of oversee and coordinate projects and programs here. That's the apotheosis of what I could potentially do. Hopefully I improve effectiveness, and I hopefully ensure long-term success in our programs. But really a major part of that is continuous improvement, just figuring out exactly what can be optimized, where we're missing targets, seeing what the next opportunities are. I try to do that with our fellowship and all of them. I'm supposed to also be a subject matter expert in GME and graduate medical education. We have a lot of acronyms. And so if there are any lay people listening, we'll try and let you know about our acronyms. But so, I need to be the subject matter expert. The buck has to stop here as far as requirements for, licensure or for accreditation. That's sort of my bailiwick. And doing all that, I monitor our progress and any problems that come up. I think that's really all of my roles. I wear many hats.
Well, technically, you're very expert at all of our Zoom meetings, and you really helped me get up and going running this podcast. Wow. So I certainly appreciate that, because we are now probably on our 50th or 60th episode at least, with thousands and thousands of downloads. So I think it's been really great to reach lay women and physicians, because we've done some continuing medical education podcasts for physicians. Now, you wrote a column for our SpeakingOfWomen'sHealth.com website several years ago, so I want to read a few excerpts of it because it's so interesting. You said, "Until I started my position here at Cleveland Clinic Women's Health Institute, I was under the impression that doctors went to school for about 1,000,000 years and that by the time they got to see a patient, they were completely educated and autonomous. but that turns out not to be true. So in my role as a program manager in OBGYN and women's health, the task of ensuring that your physician has all the requisite education and experience falls on the educational team and the educational institute. And requirements vary widely for different specialties and various disciplines. And so you talked about how physicians matriculate from medical school, whether one is a doctor of medicine and has an MD degree or a doctor of osteopathy, like Dr. Fiffick, who just graduated, who was a DO. And medical school takes 4 years to complete after the undergraduate degree. And you talk about how part of your job involves finding and arranging hands-on experiences for medical students with our clinicians who maybe don't even know what type of field they want to pursue. And that there is a formal program called an acting internship in which fourth-year medical students will be on service, acting as the first-year resident, which is also called an intern. After medical school, people go on and get a residency in various areas. It could be orthopedic surgery, internal medicine, family medicine, neurosurgery, so many different specialties and subspecialties. And you're also involved with our innovative OBGYN residency, which kind of differs from other OBGYN residencies. You want to talk about that tracking system a little bit?
Absolutely. And you started to talk about some of the benefits of tracking. This idea that you may not come into contact with the thing you're most interested in medicine until you start actually finding your own way. We integrate this into our own fellowship. The Specialized Women's Health Fellowship has great opportunities to direct yourself towards your interests. And in fact, I recently had a meeting with our nursing institute who is finding the same problem with our nursing students coming in. They're not getting exposed to all the things that may make them most integrated and sort of self-actualized in our healthcare system. So one of the great benefits is to be able to deliver those kind of experiences, whether it's, just shadowing somebody in psychiatry just to see what they're doing, going to see our experts in cardiology, or, the various little specialties that we have. Just getting your feet in those doors, and actually the networking aspect of that too, besides the learning aspect, but the networking is actually also quite valuable. So with our residency, we've integrated several distinct time frames where the residents will figure out what exactly is it they want to see, and many of them like to come to you, Dr. Thacker, especially if they have secondary interest in reproductive endocrinology and infertility. Which is you guys kind of share some margins there. You share some specifics.
Yes, we're the queen of the ovaries, and the field of menopause, which I specialize in, deals with ovarian aging and the consequences of that, and really is an anti-aging field. So our specialized women's health fellows are a little bit different than the typical OBGYN residents, who many of them go on and either practice obstetrics or do general OBGYN, or some of them go on to other fellowships like in reproductive endocrinology and infertility to do IVF. Some deal with prolapse and incontinence and go into urogynecology. We have a newer field of minimally invasive MIGS, gynecologic surgery, of people who are just doing minimally invasive benign surgeries. And of course, we have gynecology oncology that deals with all the female reproductive cancers. So most of our fellows either usually come from internal medicine or family medicine, and some actually have done some training in OBGYN, but then we're a little bit more interested in the medical aspects. But even after they finish their residency, they find that they need extra training. And our fellowship, do you want to talk a little bit about our fellowship, the 2-year fellowship, kind of the how people find out about our program and how they apply and what we take a look at in terms of determining whether they're a good fit?
Absolutely. In fact, it's my pleasure. One of the great benefits we have in our fellowship is the ease of access. You can easily apply to us right on the Cleveland Clinic website. In fact, I think we can probably put a link in when we post this.
The show notes, yes.
Yeah, let's put a link there. But so we have a number of really core offerings. No, the first of which is probably being able to work with Dr. Holly Thacker. So we underestimate and we misrepresent sometimes the value of actually modeling people, learning how you can work and how you can get ahead in a field that may not necessarily have your best interests at heart. And Dr. Thacker has figured out how to navigate many of those problems. So modeling Dr. Thacker and just being around her for 2 years is a huge benefit to our fellowship. But also this idea of tracking, figuring out exactly what parts of women's health you want to be an expert in. You're going to get, as you said, the aging of the ovary is a very interesting theoretical construct here. But it's also general women's health. A lot of the things that even deeply advanced internal medicine practitioners don't necessarily have the experience that you will get here. The outpatient clinics that we build into the fellowship are also valuable. If you come from a family medicine background, you'll have family medicine clinics for your first year. And if you have internal medicine, you'll have an internal medicine clinic. So being able to carry on what you've been learning into actual practice is something that all residents miss. This is the thing that they want to do. This is the thing they were trained to do. So we give them a year to, kind of get off of that. And then the next year they can specialize and have their own clinics in specialized women's health, where they can take the knowledge they've been learning for that year and start to apply it before going out into the world. The other thing is being around and integrating with some of the actual specialties within OBGYN is something that you can't get other places. We have world-renowned practitioners and in fact, world-renowned students here. So being able to bump elbows and learn from all these people, those are specific offerings from our program.
Yes, it's really offers so much rich networking and clinical exposure in terms of complicated patients and expertise in so many different areas, from cardiology to osteoporosis, to hormones, to functional medicine. In fact, one of our graduates who did the 2-year fellowship went on, practiced in Houston, got trained in functional medicine, and is certified and is now back in our center. We also have a really strong medical breast and genomics institute, and we see so many high-risk patients, and you've helped coordinate for a couple of our fellows, one even after she graduated from our fellowship and one in the fellowship, to get a lot of advanced training in medical breast and genetics. And so there's so many different avenues that people can pursue, and we're trying to make clinician leaders, scholars, to go to other institutions, although I started the fellowship because I wanted partners. And I do have a few partners who've stayed with me, but a lot of them go on to these fabulous positions, and so we have to keep training. And so we have 2 new fellows who will be joining us, and maybe we'll be having on future podcasts. Tell us about all the work for onboarding and licensure, and there's a lot of technicalities that have to be done before the physician, even though they already have their medical license, they've graduated, they're fully a physician, and they completed their residency, so they could otherwise be out in practice, but they're still choosing to come and get additional fellowship training.
Yeah, so actually that's one of the most exciting parts of the job is recruitment. Where do we find our fellows? And we do have 2 starting. They'll start in August. Where do we find them? So this most recent batch, one is from the Ohio State University, but she also went to Case, and so we have an interesting relationship here with Case. Most academic medical centers have a school that they work with, and we are blessed to work with Case Western Reserve University as well as the OU Heritage College of Osteopathic Medicine. So I run into a lot of these people. Helping arrange rotations here at the clinic. And so we have a great opportunity to retain them, and that's one of the reasons we got Dr. Kamat, whose new name escapes me at the moment. I apologize. But she actually was one of our students here and was intrigued by your fellowship even back then. There are a number of ways that we find our fellows, sometimes just a huge email. But we find them, honestly, where they find us. We have a great candidate right now. I just put 2 more letters of recommendation on your desk from her. And so I find that really fascinating, the way we get them. And then hopefully we can retain some of them. Sometimes we send them on to private practice where they produce and are very, very popular. So really this recruitment part, the second part of it is actually get them ready to be onboarded. So can they get a Ohio medical license? Do they have visa issues? These are all things we deal with. Everything from residency to actually doing the onboarding, getting them here in person for that. Interestingly, and I don't know if other programs are like this, but we have an occupational health requirement where they have to do testing and they have to do fitness checks 2 weeks before they start here. And so sometimes we have international people who need to come to Cleveland 2 weeks before they start to be tested and inspected.
Oh, wow. So that's something new. I know for some time we would not hire anyone for training or employment if they were cigarette smokers. I know that's been a policy for a long time. So now there's an actual fitness requirement as well. Is that right?
Well, so by fitness, I mean they do fit testing is what they call it with masks. To find the optimal type of mask. We actually don't have a fitness requirement, although there is the HR requirement that you can sit down, stand up, carry 25 pounds.
Okay.
But even there, in training, we don't necessarily have to adhere to that. In the clerkship, the medical student clerkship, we recently had to figure out a way to get a student who is totally in a wheelchair, a self-propelled wheelchair, into the OR and out, and to actually get her a good training experience. And we accomplished that, and it turned out to be sort of a best practice for special needs individuals that require training.
Fascinating. And there's lots of orientation, and you really help guide not just medical students and residents, but also our more experienced fellows who are obviously older in the medical training system, just finding all the resources in a huge academic medical center.
Well, and interestingly, so we talk about onboarding all the time, but then there's offboarding, which is actually just about this time of year. So gathering the records and then preparing to transmit those records to all of the entities that want to know whether or not a person was trained. That's a big job as well. We've got a few systems to help us with that. Every organization has different ones. We use MedHub to kind of gather and integrate everything. But there are also, some of our professional societies here at the clinic can be record letter writing or gatherers of records for training. The Office of Professional Staff Affairs is one of such, as well as our graduate medical education department. So yeah, there's all of these various aspects of training that actually happen to be going through Confluence right now. Go on.
Oh, I was just going to say, so there's lots of ACGME, and can you tell us what ACGME stands for?
That's the American College of Graduate Medical Education. They're sort of like an overarching accrediting body. They have a bunch of standards, and our fellowship is getting closer and closer to those standards as time goes on.
So we're not ACGME accredited because when I started this program, and it still is very innovative, it's not a standard field like OBGYN is, or neurosurgery, or orthopedic surgery, or pediatrics, where there's a body that grants board certification. So we've come up with our own certifying intake test, outtake test, educational portfolios, and certain credentialing that we want, because we're pulling from multiple different fields, but we still run it just like other programs in terms of we do self-evaluation, the fellows does self-evaluation, we evaluate the fellow, the faculty evaluates the program, we work towards process improvement and quality assurance, and you've been very key in those areas, and doing the programmatic reviews and doing the 6-month evaluations that we have with each fellow.
Yeah, and the the goal is to continue to standardize this process and get closer and closer to ACGME requirements. Who knows what the future is? There very well may turn out to be an accreditation through internal medicine or family medicine for something very similar to this type of fellowship. Although over the last 30 years or so, that hasn't been the case. Who knows what the future holds? So we like to be prepared for it.
Well, I think we want to have high standards, although actually one of our graduates, Dr. Heather Foreman Hirsch, who went on to OSU to run their midlife program and then went to Harvard and then went on to do some telemedicine and now is doing a lot of media and has written a menopause book and has been running her own podcast. She wrote an article kind of going over the pros and cons of accrediting versus, having board certification versus not. I kind of hope it's not, because I want the ability to pull from any other field where someone is interested in midlife women's health that crosses different disciplines, that wants to get not just clinical expertise, but also some research time, some time to develop educational curriculum, as well as leadership skills, because we try to focus on all three of those areas. Do you want to talk a little bit about our research program and some of the leadership courses we have, as well as simulation that we have for procedural things?
Yeah, happy to. So as far as our research, we dedicate half a day a week to research for our fellows. This is a time for them to either physically perform. We actually don't have a lot of prospective trials that we do. We do a lot of retrospective things. We do a lot of I'm sorry, I'm blanking on it. When we look through the charts and
clinical research.
Thank you. Yeah. So we have a block time for that, but we also have availability for learning through simulation. We have several different simulation types, from implantation of IUDs to various examination simulations. We have a virtual reality suite that we use for all of that. We have so many opportunities for research and education here that we don't necessarily even use. And I think that's also another goal that we can put forward for the future, is to take all of these multitudes of resources and make them more available to our fellows. There's already a surfeit of opportunity, but there's no such thing as too much opportunity.
Mm-hmm.
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we are the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
And we have grand rounds and journal clubs and a lot of events. Now, during the pandemic, I think it was a little bit difficult for anybody in any aspect of medical, nursing, any kind of training. And so you help bridge that gap with lots of remote meetings and Zoom. Although it's so nice to be back where people can congregate. And in fact, tonight I'm going to the Bone Club, where I usually invite the fellows to come. It's a multidisciplinary group, and we've not met in 3 years. And tonight's going to be the first in-person, face-to-face meeting. And it's people that are interested in osteoporosis, which is lots of different disciplines. It doesn't just fit in one area, just like a lot of what we focus on doesn't just fit in one specialty, whether it's breast cancer survivors who might have hot flashes or osteoporosis or sexual dysfunction, or whether it's people at high risk for cancers trying to make reproductive decisions, as well as trying to do active cancer reduction. It might cross a lot of different specialties. So I think you're right in terms of letting people know about all the different educational opportunities. And a lot of our fellows go on and they publish in peer-reviewed journals like the Cleveland Clinic Journal of Medicine. I was just putting together a CME program for physicians and nurse practitioners and physician assistants, and we cited Dr. Fifik's lead article in the Cleveland Clinic Journal of Medicine. And we also have abilities for the the fellows to lecture to people of all educational backgrounds, including lay women, to help empower them to be strong, be healthy, and be in charge, which of course is our motto at the nonprofit Speaking of Women's Health. So are there any interesting trends that you see in the future for postgraduate education? I mean, obviously medical school debt is very, very crushing for many people. In fact, I know I've counseled a lot of women who I know want to be married and have children to maybe consider, if they want to be in the medical field, consider going the route of a nurse practitioner or physician assistant, because it's not as time intensive and the debt burden isn't quite as high, although there still can be quite a lot of debt. And that's something that a lot of our trainees have to navigate too, like these issues of, you mentioned Dr. Kamath, who has a new name because she just got married. People, also it coincides with their peak reproductive time frames. And we had one fellow who had spontaneous triplets during her fellowship and was on bed rest. So, lots of interesting times, because trying to build your career and build your family, pay off your debts, try to start to build a nest egg because you're getting older and getting closer to retirement. There's a lot of competing demands. And so I think that's one of the challenges. We're going to have 2 fellows, which is great, and we've had up to 4 because it's a 2-year fellowship. But it is a lot of time demands for people to continue excess training to be the best physician they can be, and yet still have a lot of financial debt and burden. I don't know if you have any advice on that.
You're exactly right about that, and those are, I would say, the 2 issues: the debt and then the life goals issue that we see again and again in all of our research. That is another function that we do in graduate medical education, is we do research. We also have a journal, the Journal of Graduate Medical Education, JGME, and recently it was published that those 2 items that you mentioned are the 2 predominant issues. And the question is, how do I balance the needs of my life? I want to have kids at a certain age. And these are very goal-driven people. The doctors in general just know what they want out of the world. So how are you supposed to balance these things? And the answer is, the ACGME has finally said to us, look, these are reasonable requirements and demands. We don't want to start losing great doctors to become advanced practice practitioners when we could keep them as doctors. And so we've increased the idea of paid maternal leave and even paid paternal leave throughout the system, as well as, we talk about wellness a lot. So the term wellness can be questionable, and it depends on how prepared you are to accept a rather elusive term like that. But a lot of what we've seen is in retention of trainees and in their outcomes, focusing on this wellness issue can lead to better productivity. We can find more research through more people who are able to care for themselves. We like to say at the clinic, how can you care for others if you can't care for yourself, right? So that balance is important. One of the reasons the ACGME was empowered to do so was because of a lot of self-harm on the parts of our trainees working more than 80 hours a week, and then all of a sudden they have a drinking problem, or fill in the blank. You know exactly what the outcome's there. So we need to empower ourselves and sort of be proactive in preventing this kind of thing. Now the money, there are quite a few opportunities there. If you work for a non-for-profit for 10 years after you finish, you can get your loans forgiven. If you do so at a health site that's designated as special needs, so areas of low quality care, we can also get your loans forgiven. We recently had a fellow who could have very well benefited from that in our system. But it's still a little nebulous how exactly we make that happen. There are some good stories of people who have successfully had their loans forgiven, but there's not an abundance of those. And so the system has been trying to address those problems, and I hope for our future that that the solution is actually not to go into a different field, as you suggested.
Mm-hmm. Right, because everybody's going to be a patient, and everybody is going to want, world-class care, and, top-notch physicians and surgeons who, work with the whole team. And of course, we love our APPs and our nurses and all of our support staff. In fact, we involve our entire team in the whole interviewing and recruitment process, and getting everyone's 365-degree feedback. And one of the things I think that's helpful for the fellows is every 6 months we sit down and do a SWOT analysis: strengths, weaknesses, opportunities, threats. We look at their portfolio, we look at their evaluations, and give them time to talk. Not that they have to, but if there's anything that's personally pressing. Many of them have had, big events like, weddings and childbearing and, aging parents and that are ill, and lots of different things going on in their life. And certainly I think our whole entire team helps to try to come around them and support them. And it's overall, I think the vast majority of our fellows they've come from very diverse backgrounds. They've gone all around the country. They've had various, backgrounds and interests and expertise. And most of them get involved in the Menopause Society and become credentialed as menopause experts, as that's one of our requirements. And have really gone on and been incredible leaders in their field. So I really just want to thank you, Chad, for being a very integral and important and talented part, and a problem solver, because there's always some problem or something that we have to look into, and your readiness to kind of find the answer and help empower our whole educational department and our center and our team to kind of be strong and be healthy and be in charge.
Be in charge.
Yeah, that's right. So thank you. You have been listening to our educational program manager, Chad Schlesinger, and he's got a couple masters under his belt and a very wide background, and he is helping to direct a number of our programs, which includes the program that I'm the fellowship director for, Speaking of Women's Specialized Women's Health, of which Speaking of Women's Health is kind of a part of the contact that our fellows have with women of all different backgrounds. So thanks for joining us in the Sunflower House. And if you've enjoyed this episode of Speaking of Women's Health, please share it with others. Please subscribe anywhere you subscribe to podcast. We're also on Speaking of Women's Health on our Rumble channel if you want to see our guest. And to catch up on all the latest from me, you can listen to us on Apple Podcasts, Google Podcasts, Spotify, TuneIn, wherever you listen to podcasts. And if you've enjoyed this and you would like to make a donation to our nonprofit, Speaking of Women's Health, please go on speakingofwomenshealth.com and hit the donate button. And I'd really like to thank our executive producer, Lee Kleckar, as she's a great behind-the-scenes person that's helped us with the podcast and with Speaking of Women's Health and all of our social media. I'm Dr. Thacker, your host, and thanks for joining us.